Welcome to the afternoon. Let's start our meeting inviting Professor Katarina Svanberg. She is a professor at Department of Oncology at Lund University.
So this is my third time I step up to this podium, and I have been at many conferences, but I'm not sure that I had talks 3 days in a row, and I hope that you sort of is not getting tired of us, because we all appear 3 times or so, and we hope that you can stand us even if we repeat ourselves a little bit. And in my part of Sweden, in Lund, which is south, when we do the hooray, we always do it 3 times. In all other parts of Sweden, they do it 4 times. So when we do a 3-time hooray in Lund, there are always 1 or 2 who say the 4th time. But I hope I will stop after 3 times here now, so I don't give 4 talks. Anyway, this is a very serious matter I will discuss now. That's third world applications of our technology. And I will present, in the first part of my talk, I will mainly discuss research that belongs more to my husband's activities. I am involved there also, but it's mainly his things, together with particularly much Mikkel Brydegård, who has a very big heart. Both of these guys have big hearts for Africa in particular, and that's something I think we have to remember, that we have a responsibility really to be maybe strategic, and maybe the most strategic way to work is to focus on these countries where the needs are so evident for us. We complain when we don't see a doctor day after we call to the hospital, but in many of these countries they never or once in a lifetime see a doctor. So this is such a different situation, and we can maybe not, until we have been there, really realize how much that influences a society. And that is the reason why it grows up these pseudo-medical institutions, which might do more harm than good. In some cases they are good, but we have to be very, very careful judging situations, because we need to know the background before we can say anything. So I think we have learned during the years, after more than 30 years in collaboration with among countries in Africa, that we believe that we should try as a whole community, scientific community, to bring a lot of our knowledge over to that part of the world. If we look at the global perspective from this point of view now, for example, look at the population. Asia is the swollen continent. If we look at burden of diseases, you see that that's Africa that stands out. So Africa is one of these continents where we really have a variety of diseases that we as medical doctors from the Western world only see in our books. And when I first came there many years ago and saw this, I was so surprised that I could see with my own eyes all these diseases. We heard from Olympia the other day here, all these disastrous infectious diseases that are there, and that's one of the burdens actually. And number of medical schools, that's interesting to see. Look at South America, how well equipped you are. You have much more per capita medical schools than we have, for example, in the western part of Europe. But look here on Africa, this little tiny continent here, if we compare to the burden of diseases. So this is sort of the background of part of my talk here. And if you talk to people, they say that there is one single obstacle for full development in Africa, and that's malaria. Because malaria affects so many people. and it's a chronic disease. Some people can be treated to full cure, but usually the adult population in many countries in Africa, they are affected by malaria by the cycle over the years, and only the small kids have anti-malaria medication, as I have learned down there. So that's one aspect that we really would like to take into account, whether we could do something. Again, Olympia from University of Padua, she talked about Julio Joris and her work. If photodynamic therapy could be used to kill the larvae of the mosquitoes, that's wonderful, I think, if you could kill it where it starts. Other ways we could maybe help here is to find good techniques to detect malaria. It's not so easy, actually, and one of our collaborators down in Bamako, his daughter had malaria, and they could not detect it very quickly, so she got very ill before they really had the diagnosis. So Jeremy Shohei now is the leading scientist in Africa within this project that I will discuss, and he has the personal experience on this. It all starts, as I said, with some kind of insects, and this is some ecological, nice green pictures here from Sweden, a little river here. And this little river is the home of these flies, or these damsel flies here. And what they do here is that they try to see whether these optical techniques, reflectance, fluorescence, could be used to catch how they maneuver, how they fly, the social interaction of these insects. That might not look so important, but if we think a little bit further, how could this be used? In countries where you have these pests, these really ugly small things that eat, like in China, 15% of the rice crops, if you could find the pattern how they move and put the pheromone traps exactly where they would like to go, and instead of them having to go to the rice fields, go into these pheromone traps. I don't know if you are aware of them. They have the sort of the same smell, and for the men are always fighting to get women, and they are always sort of rushing to get women, and that's exactly the same for these pests. They go for the females. But if instead of the females who are in the rice field, there could be put up these pheromone traps, so they go into these instead of going to the rice field. But then, of course, you need to know how the social pattern, why they fly where they do. And that's the reason why this is very important research, actually. Here they have collected reflectance spectra from these different animals. And the spectra differs whether they fly over water or they fly over green grass. So this really reflects the surrounding where they move around. And that's what they have detected in a very nice way. I heard during lunch that you can detect by using the sun as the source, the spectroscopy of the pollution in China. This is a little bit the same thing, because what they use here is the sun as a light source. They have a telescope, and they send in the beam into a dark box. And when an insect crosses there, they see these blips of the insects, so they can sort of pattern out the ways how they behave. For malaria detection, they have developed a very, very interesting microscope where they can look both in the dark field, in reflectance, and in fluorescence. And utilizing all these different wavelengths, we have seen this in other talks here, that these LEDs are actually important because they can be found in many different wavelengths. This is the curve of the detector, the sensitivity of the detector. And malaria detection in blood smear may look like this in this kind of microscope that I showed. In transmission, in reflectance and in scattering. And some of these blood cells here, they are infected actually with malaria. They also used the multispectral, or the multivariate analysis to find out if they could even more properly find the malaria-infected blood cells and increase the sensitivity of detecting this disease. I will show you some nice pictures from field tests that we have done down in Africa. This is from Mali, and we have Mikkel Brydegård there. We have Abuma, who is himself born in Ethiopia, and he together with Mikkel and my husband and myself, we have made up a team going to Africa. And this is what one of our collaborators said down there: you come here because you are not afraid of Africa. And I think Africa is a continent where you can find so friendly people. Of course, there is a threat, because it's not only African people who are infected by malaria. We have the threat all the time when we go that we will be affected of it. And one colleague of myself, a doctor, who has a big heart also for Africa, he's an anesthesiologist. He mounted down one of the nice endoscopes, which were not used anymore, in his department, took it down to Nigeria, and had a trichosomas infection, and has now to go through 3 months of very heavy treatment at my hospital. So that is something we have to keep in mind. To be brave, to be careful, but that it is sort of worth so much when you see these happy faces. These are nice pictures. He is from Sri Lanka, actually, and he is also in the group. He works together with us, and he has special money from Swedish government, actually, to work together with us. This is from Bamako, Mali. What they are doing here is that they are detecting these flying small insects during the night. And it was interesting to see that also the television found this interesting. Not only the wars and all these bad things, but they also found that this was something that they could report to the whole country about this little study that we were doing there. And this is actually my husband being interviewed there out in the field. Some other nice pictures. I will come back to this picture. This is from Lund. This is from Atomic Physics Division in Lund, when we had a workshop. I will discuss that a little bit later. And what is interesting here is to see that the professor, he's Paul Boabasua, is working here with his former student, Benjamin Anderson. And I'm quite sure that this professor, not saying anything bad now, but they never sit down and work with their hands like they did here. So we pushed them to work and to build up their own equipment. And that worked perfect. And they were very happy when they could bring back their equipment. Because I think when you are involved in this kind of work, we should really look upon us as advisors, or more like colleagues. And we should, because there is always a possibility for us to think that we know better. But we have to remember that the situation they work in, they are the specialists, and we are the ones who should be helping them, not the other way around. And I think that's something that we have to keep in mind all the time when we are working in these conditions. This is from a field test in outside Nairobi in Kenya, September last year. And you see all these equipment here, they come from each country. So every country who took part of this, Mali, Kenya, Ghana, Senegal, had their own equipment. And that was built up, and then it was brought back to the countries. And here they are detecting with Raman spectroscopy water quality of Niger River. And you see here different spectra from the water. And you see the laser beam here is a Chinese laser shining towards the water here. What we see in this one is a big insect flying into the beam. This is the sign of a little mosquito flying also into the beam. So with this equipment, they could do a lot of interesting monitoring, which are of importance. Of course, if it's pure water or not, that is one very, very important factor. Now I come back to what I said before. This is a picture of the Lund African workshop, and here we see representatives from 7 countries, from Senegal, Kenya, Zimbabwe, Ghana, Sudan, Tunisia, and Ecuador. And they are here visiting at my own department. We have Dr. Neil Spencer there. We have my husband here. This is Amadou Wagé for example, from Senegal. And we were inviting them a full month. So they stayed in Lund 1 month. We were talking to each other. We were discussing. They pointed out what they were interested in. And together we could really find that something within light interaction with biological tissue or biology in general was something that they were interested in. And we took this nice picture. Somebody reacted when I showed this picture. But I love it because it really tells us that we are friends, because we are stretching our arms to each other. And the Danish arm with his skin, so bright skin, together with this guy from Senegal, it really tells us a whole scale of melanin content. And I would love to have a little bit more melanin, because then I could be out in the sun. My mother was a Walloon, which means that she was the daughter back from an iron worker from France. So she has a little bit of better melanin than, so the second one here is mine. The third one is a Chinese lady we were working with, and these are all from West Africa. But what I would like to say with this picture is that if we go out in the sun, we should do it very carefully if we don't have this good amount of melanin to build up our protection. That's what the Cancer Society says in Sweden. Sunbathe 10 minutes, 15 minutes, and gradually you build up a little bit. Otherwise, you have to come to my office and be treated for skin cancer, and that's okay. So here you see again another composition of people. This is Amadou Wagé here together with his students, building up their equipment, and this is only for showing that components put together could bring back very nice equipment, cheap equipment, but top-notch scientific instruments. So it's not necessary only to buy from the shelf. You can also your own. You can produce. You can the compounds can bring up and integrate very nice systems. After this, we were invited to Senegal, and this is a team here. Malik Diop, an ENT doctor, Colin. He does exactly your work there. Amadou Wagé is Vandelay. He is a physicist. Ababakar, he is a postdoc. We always need good postdocs because they can do so good job, and they are very eager to get higher up in the hierarchy. So always remember when you grow up a little bit, you students, that postdocs are the ones that you really should rely on because they have more time than we professors do have most of the time. Okay, we have this lady here. We have my happy husband. He's my husband since 43 years. So we were absolutely too young for love when we married, but still we are married and we love each other maybe much more now because it was my mother who found him. And she told me that this guy is one for you, she said. She met him in Italy on a parking, not on a parking place, but on the camping place, on a camping lot in Firenze. And they started to talk, and she even showed pictures of me. I was not there. She showed a picture, and she said that this is my daughter. She's at the same university as you are, and okay, blah, blah. And then autumn came, and she said, oh, did he call you this nice guy? No, I said, he didn't come back. He was most probably scared that you were so eager to show my picture or whatever. But that turned out to be a very good arranged marriage, I would say. And not only in India or wherever they can arrange marriages. So trust your mother when you choose your partner. Okay, Nils Benze, perfect dermatologist. That's the one with skin type 1. So he should be very careful in Africa. But we work together so we can treat ourselves if something happens. What we did was that we took equipment with us, light emitting diodes, the Norwegian version here, mounting them up, starting to mix ALA. I brought my Christina with me. Christina was our nurse. She was a student at that time. And she was so fascinated, actually, of the work there. So later, when she was a student in psychology and had to do her master thesis, she went back to Africa and did her thesis alone. I tell her, you are much more brave than I am, because when I go, like here, people are standing with a little sign, Katarina Svanberg, and that's nothing. Then you just follow this person and they take your bag and everything and go away in a car. When she came, she had a person waiting for her because I had arranged that. But then she took care of her own. She was moving alone on the streets there and stayed 8 weeks and interviewed 150 orphan kids and made her master thesis as a result of that. So that, I think, I really introduced her interest for Africa during these weeks we spent there. One of our first patients, you see the conditions here, not so good, but that really doesn't matter if the mentality is the right one for working together. And started to treat, which was, of course, something which really attracts your human thinking, that you can do something good. And I also found this little beautiful girl here. This is not a pin. This is a thing that she's breathing through because she had a big tumor in her throat. So she had this instrument there to help her to breathe. And of course, we didn't treat her, but it really told me that whatever could be developed to help these people is of very high strategic value, I think. Another lady, mother of 2 girls, this lady here. African people, when they develop these type of tumors we were treating, they have no pigment. These tumors have no pigment. They come in areas where they have no pigment, so they come on the hand, in the hands, close to the eyes, or on the foot sole. So that's we can treat them with photodynamic therapy because they don't have melanin, which otherwise absorb all the light and only induce heat. We took the spectra with their own equipment. You recognize nicely here the sign of protoporphyrin, and this is a normal tissue. They look exactly the same as they do home, so that was also something that they could publish later. This is from pediatrics clinic, and Christina is there talking to a little patient, as you see. That's where I found this girl also. And this is the food storage, because in these hospitals there is no food coming in, rolling into the corridors, into the rooms. They have to prepare everything themselves, and that's something that we saw very, very evidently down there. And of course, you build up relationship. Christina here with Amadou Wagé. They are friends forever. They always send greetings to each other. And for me to work with this very elegant African doctor, he had a lot of respect with him. So I'm joking a little bit here, and that was the most I could do because he was very, very serious, but we had extremely nice collaboration. I talked about the food. The African wife here is cooking food for her husband because her husband is at the dermatology department. And isn't this good for us to read? Wives never give up to support their husbands. This is some kind of feministic sentence, isn't it? Okay. Whatsoever, this is nice to see the difference from what we have. We were lecturing also. We had some kind of summer school before we started, and we also had a nice experience some year later, or maybe earlier, I don't remember, this is 2007, but I only want to show that to collect scientists wherever it is always a great honor for us. And this guy, for example, from Palestine, this is a Spanish lady, this is Mikkel again, this is a Japanese. He was one of the directors in SPIE, and some other people here. And I also had the possibility, like I will have in a few hours here, to give out SPI prizes. And this man from Bulawayo, he won the oral presentation prize. And this is Paul Boabasua here, who was the organizer of that conference. The rest of my talk, I will discuss a little bit how the learned societies may come in these circumstances. SPIE, which I represent together with Bruce Tromberg here, is the International Society for Optics and Photonics. And that's actually one of the sponsors for this conference. I don't know how much they sponsor, but I know that they are on the list of sponsors. And I'm very happy for that, because for SPIE, you should remember, you students, that you are so important. We don't, or SPIE doesn't earn any money on you. You cost more than you pay. You pay 10 or 12 or whatever dollars. It's less, very little you pay. But we appreciate your membership so much, and we really would like to see you follow up, and when you grow up as scientists, continue to be included in a society. It's not necessary with SPIE. You could choose any society. My husband at the moment is on the president's slate for OSA, so that's nothing bad with that. But you should keep in mind that to building up network is so important. And these societies, one of the very important aspects is really to be a facilitator for building up networks, contacts, whatsoever, scientifically, or when you eventually look for a job. That's also where the learned societies can come in. Many students, chapters around the world. You have one very active here, and I'm very, very happy to meet you here and to find how active you are here. And I will report back to the headquarters that now I have seen Brazilian student chapter, and I know that this is a very, very active student chapter. So congratulations to all of you who are included there. The prerequisite to form a student chapter is 10 students. OSA have 5. You could do either of it. But you need to be active, and actually the societies follow up on the student chapters. And this is a very good example on how student chapters can come in together with the organizers in a conference like this. We have here, we are talking about Africa. We have here only one, but now, which is not on the map because it's very newly founded, is one in West Africa. But they are not at the same university because there are too few students to form a chapter in one country. So they have what we say a distributed student chapter. And I think they are now 27 students, and that's, we call it the West African student chapter. More than 2,000 students are involved in the chapters. The whole society holds approximately 19,000 members. So 27%, approximately 30% of SPIE members are students. And you are the growing group in SPIE, actually. As a president, or even before I was a president, when I was like Bruce here, a board of director, we had also, it's not only, why I show this picture is that SPIE is so eager to help or to support the students in their growing in science. But SPIE also have the possibility to celebrate giants in science, like here with Charlie Towns, the great man in laser, and I gave him here both the gold medal and the plaque of being a fellow. So this is something that that is really good with the societies, that they can appreciate good work. This is from Lima. I appreciate so much when I see girls clever. It's no wrong with the boys. I mean, you should also be very clever. But girls has girls have a little bit obstacles, because we should be, when we grow up, mothers. We should be nice wives. We should look nice. We should take care of everything, because a man usually takes care of the big business, world politics and so, and we take care of the close surrounding. I don't know. I see in my family now, my younger, my son-in-laws, and in particular one is very good. So I think we have been able to educate the new generation, and I hope that you will be this new generation, so you can really help the ladies to also do science. Why are there so few Nobel laureates who are women? Yeah, you can ask yourself. There are very few. You can count them on your hand the recent years. But they say that in a few years, when you grow up, you men, and you are equal to in this kind of manner, there will be many more women, because we are equally well equipped like men, but we may not have the possibilities all the time. Okay, this was a little bit politic, so I don't know what. But that's what we see. Here we have a very clever man from Lima. He also got the prize, as you see, and that's very nice. SPIE table here. You have organized for a very nice table. Visit that and take out all information you can. Or this, which I showed before. I said that there are mainly two societies at OSA and SPIE, and this is from a conference in Latvia, in Riga. And I appreciate so much when the two presidents, the two young student presidents here sit side by side. He is SPIE, he is an OSA guy, and they organize together. So this is maybe even better, because then you are even stronger. One is one, but two is much more strong. Another interesting conference I was at, that's from, the organizers were from University of Bucharest. It was organized where the castle of the one who was eating blood, I lost, Dracula, yes. This is Dracula's castle. And Dracula, he went out in the night and did bite the young females. And why did he do that? Because he had no ferrochelatase. He could not bring his protoporphyrin over to him. So that he had a porphyria, a disease which really did him not going out in the sun, because he had the skin sensitization when he went out in the sun. I mean, this is all crap, but that's what they say. Anyway, this is a very nice castle. And the Bucharest students here, student chapter, organized this conference. And they invited several people. And in particular, one you should remember here is Michael L.A. He from Pennsylvania State University. And he talks to the student about how to make a good PowerPoint presentation, how to put together your results in good papers, how to, you know him, you have heard. Oh, good. He also teach about how to put together a good grant. So this is very good. And what was warming my heart was to see that Laura here is the president of the chapter at Bucharest University, and Clementina here. She is a very important person. She has been all her years an advisor to the students, a mentor type of person. And that's very, very important for you students, to find a good mentor, because a mentor can teach you how to behave in this complicated academic world. Because there are so many stumble stones, I think that's the English word, isn't it? Stumble stones. When you fall over something that you had not anticipated. But the mentors can really tell you, if it's a good mentor, how to behave. And I think she is a role model for being a mentor for the young students in Romania. I visited ICFO, which is the Institute of Photonics Science in Barcelona, and they have a very interesting SPIE chapter. They have a chapter with all these countries in their chapters. So it's not only Spain, as you see. They have a lot of foreign people, and they formed this very international student chapter. Japan, another interesting area or city I visited, both Tokyo and Osaka. And I saw this nice composition of two student chapters, OSA and SPIE. But what I didn't like was that it was one single girl. All the others were males. So these two chapters had one girl. And I said to them, next time I visit here, I would like to see at least 5 or 10 girls. And they promised. I don't know if that will happen. SPIE has also been involved in another very important organization, and that's to work together with Unesco for bringing out optics to the teachers who teach young people. So ALOP stands for Active Learning in Optics and Photonics. And this is Eugene Arthurs, the CEO for SPIE. This is Marcela Nales, who was a responsible person at Unesco, and Minella Alarcon from Philippines. These two together took responsibility for this program, and this is still running, and SPIE is very, very highly active in this program to bring out the scientific teaching to the teachers. Teach the teachers, because that's, of course, important. Ukraine, I think we have one student here from Ukraine, actually from Kharkov, from this particular city. I was there, and it was the first international conference for young scientists, another extremely nice initiative. And the president is right here. You see how nice, how presidential she looks. The UNESCO Ictp International Center for Theoretical Physics outside Trieste in Grignano, a little fishing village close to Croatia, is a very, very important organization, because to this international center, students from, in particular, the developing world come for weeks to be taught in optics. Every winter there is a winter college, and the topic in optics, and the topics vary from year to year. This year it was laser applications. Next year is more basic research. And as you can see, the composite of students here is interesting, because there no political boundaries are there. Everyone joined together and have a perfect interaction. The Ictp director is Fernando Queveda. I think he's from Colombia, so he is almost your neighbor. Queveda is a theoretician. And I joke here a little bit, because I say here that he has given me the first lecture in string theory. I mean, I didn't get so much, but I understood that there are many different dimensions, and that's what he was drawing here. So he did a try to introduce to the stupid doctor what string theory. We can ask the physicists here how much they know. I asked my husband, and he said, no, I think there is someone else in Gothenburg who knows this. SPI is always supporting a laboratory there with a laser system, where students come and do their sandwich, something which we call sandwich program for PhD. They do part of the work here, they do part of the work home, and then they come back, and together these sandwiches make a PhD. And that's something that Ictp and SPIE is supporting. I will point out here Maria Jutzel. We have 2 students from Maria Jutzel here, and she was president of SPIE 2009. An extremely important person. Not tall, as you can. She is the shortest of us, but she has a network which impressed me so much. She knows everybody, and she has a big, big heart for South America, in particular Brazil. So even though if I don't have greetings from her, I think I could greet from her, because she said long before that you should go to Brazil, because that's so interesting. So now I have conveyed greetings which I didn't have, but I will tell afterwards that I sent her greetings here. At this winter college, also the International Commission on Optics give out Galeno Denardo Award. here to this, that's Amado Vagui again, that's Maria Calvo, who was the president of ICU, to this, he is from Philippines, and he is from Mexico. They both got this very, very important prize actually down there. As well as I did to the students at giving out prizes, like we will see here during the afternoon. And SPIE has also given out the Educators Award to the ALOP team. You remember Active Learning in Optics and Photonics. So SPIE has an Educator Award, and here it's given over to these people who take active part in this program, teaching teachers in optics and photonics. Juni Mela, who is the director of the optics program at Ictp, this Indian guy who has worked in the US since long, that's no problem, but he's Indian, so he has a big heart for India. And Ben Lakar here, Sora Ben Lakar, comes from Tunis. And this is a nice picture. Every winter college has a nice reception where Juni Mela plays his saxophone, and that's something that the students appreciate very, very much. We have Maria Jutzel there. And we have Eugene Arturs, who is the CEO, as I said, for SPIE. So with this, I have tried to show you, and also with my other talks here, how we have been working with the translational research from the lab bench to the patients. Because what I believe when we are in this field is that we have to be connected interdisciplinary. We should not do only physics, we should not do only medicine, but we need to connect and to learn from each other. We should never pretend as a physicist that we know medicine. And I should not from medicine pretend that I am a good physicist, because that's not true. But what we should do is that we should be very deep in our own knowledge, and then we should combine that to make something very good. We have been able before at least to do pilot studies, few patients. I hope we can do that still. It's much more difficult these days to do it. But sometime we may come back. You are in the position now that you can do it, and you should take every advantage of the best situation you have now. We are losing it in Europe and in the US. And if you can connect yourself to big companies, you have to build up your own spin-off companies. Because if you are as clever as you can be, and you do very good development, but you cannot bring it out to the patients, then you have not been fully successful. And the companies are actually the ones who bring it out to the patients. So you have to connect and to try to convince venture capital to invest in your company, to reach out to many patients with realistic technology, high technology, which is very good. Do training programs if that is important or necessary, and be persistent, because that's what I have learned. I said that in my first or second talk here, that if you are not persistent, you will never be successful. And now the Chinese picture here. This is my new hometown, Pearl River. I work on an island in Pearl River. This is the evening view. It doesn't look that nice every day, but this is a nice picture of Pearl River when it's really glowing in light. Thank you.
Very nice, very nice. You know, in talking with people from, for example, the Gates Foundation, who are very interested in impacting on the developing world including through technology. One of the points that I've heard made is that it's very important not only to get instrumentation and techniques that are applicable and usable under the real field conditions, but also that the instrumentation or the technologies should be locally manufacturable. So that at the same time as the healthcare is improved, the actual economic situation is improved, and there's a complete sort of societal integrated adoption. So I just wonder if you had any comments on that from your experience.
That's that might be the hard part of it, to really get connected. And another thing that I didn't point out now, but that's to really get the people on your side so they continue when you turn your back and go away. And that has been something that we have been struggling with a lot. To find companies in these countries is not so easy usually. And I mean, what I see here, for example, when the companies work together with you and you design together with engineers, that's a model how it should be done. I have not seen that during all my years together with people which I work together with in Africa, for example. I see it a little bit in China, but I mean, I think you are so clever here, because what you build up is what you would like to have. And then you use it. And then if you see when you use it, it's not so good, you bring it back and you improve. So I think you should really write a paper somewhere and bring in front your experience, because I think it's the first time I saw it, even though I have been working and visiting so many places, the real collaboration you have on the daily basis in the same area with the engineers in place. And I think that's one thing that because you can bring any good technique, you can bring anything which has a value, if it's not accepted and if it's not brought that way so they understand the potential, how to use it. Because a great threat is actually that when you turn your back and go home, there is only dust over the equipment. And I have unfortunately also seen that. What they have done in Africa, which recently, is that they built up a virtual network. So they have over internet discussions. And I think that has improved a lot during the last 2 or 3 years. That they really, and that's a young students who has formed this network. So they I don't know what the periods are, but every maybe months or so they have a Skype meeting, and then they discuss how to improve, what they have done, what kind of measurements they did, how they can publish and so. And I think that's one way of solving this.
I just want to add one thing to Professor Katarina's talk, that we have a very wonderful, active SPI student chapter in Sweden as well.
That's true, but you should never talk on your own. You are never a prophet in your own city. No, that's true. We have a very, very nice SPA chapter in Lund. And that's also a very international chapter.
Very inspiring talk. Thanks so much. And I just want to know, when you are bringing medical technology to a different country, do you face any cultural limitations when you are doing this type of thing abroad?
Yes. And I remember when we were, we went to Portugal, to Oporto, to Manuel Pes Clemente, a colleague of you, Colin. A very, very influential man, because he was educated at Harvard. So he went up in hierarchy very, very quickly when he returned to Portugal. And we came there with all our equipment. We had actually, I think we drove down there, I don't remember, but we had a full van with things. We came into ENT department, and we were about to start the clinical trial the day after or 2 days later. And then I asked Clemente where his ethics committee approval was. And it turned out that, that I have forgotten. And there we were with all the patients were already recruited. But they were very generous, and I started to write an ethics committee application there, and in less than 24 hours it was approved, actually. These are some years ago, but I think it helped with Clemente, but it also helped that they saw that this could help the patients. And that's what I think the ethics committee these days in my country, for example, they look so much upon the risks, and they don't see they cannot evaluate how cost effective, how good it could be, what potential is there. They much more see on the other side. And of course, this is a scale. You should weigh one thing against each other, but you should not be overloaded with one or the other side. So that's something that I would like to teach the ethics committee members, but I don't think you teach them anything, because you only obey to what they say. That's a position you have.
Yeah, I have a question concerning basic education. Is SPY worrying about, like OSA, they have some activities,
Yes.
for basic education in optics.
Yes.
So what is SPY doing on this sense, like teaching young kids basic optics?
There are different possibilities. I mean, they have CD courses, they have posters, and I think every school can order these kits, these optics kits, for example, not kids, but kits, to train train the students, and also what I discussed here with the active learning in optics and photonics, but that's mainly 2 countries which are less developed, so that's the reason why I mentioned that in this talk. I think we have another important aspect here, and that is how to teach doctors, medical doctors, biomedical optics. Because I think until this is part of the curriculum, we will never recruit many doctors who are interested in this field, because for the simple reason that they don't know the potential which is there. So I have been discussing that from the Swedish point of view, how, if it could be pressed into, I looked at my daughter's curriculum, who is a doctor now after a few years, since a few years, or since 6 years, I think, or so. But she never had any biomedical optics in her teaching. Now she is anyway a PhD student in the field, but that is not due to the fact that she was taught in the medical school. So when we have had meetings on the European level in Brussels, I bring that forward, because that is so important that young medical students are aware of the potentials which we have here.
I'd just like to compliment what Dr. Bagnato just said, just asked about the basic education to small kids that SPIE could help to develop. And right now we have just submitted last Friday, a project to the Knowledge Olympics here in the University of São Paulo. And our project is to go to schools, to favelas, to technical schools, fundamental schools, and teach optics to the little kids with some nice experiments like making homemade holograms, telescopes, spectroscopes, and things like that, and also lecturing the very basics of optics and photonics in a friendly way to the kids to get involved with that. In this project that we submitted to the University of São Paulo, we are eligible to earn about 5,000 reais, which corresponds to about $2,500, something around that. And the SPIE also complements that. There is the outreach programs that they have, and they can also complement to up to $5,000 to help to the same thing. So for the same project, we'll have at the same time the support from, we hope to have the support from the University of São Paulo and as well from SPIE. So we can fuse the education in optics and even basic physics and mathematics just with the help of SPIE. Most of the members in this project are from our chapter in São Paulo, and we have even other members. We have 3 full professors participating to the project, and they are not necessarily linked to the chapter. So we are really intending to diffuse the thing here, and SPIE definitely is helping us to be successful in this project. Thank you, SPIE.
Can I add to that also that it's one of the duties, I think, for the student chapters to really bring out the knowledge to young people, because you may have easier to reach them than senior people have. So that's one of the big duties I think you have.
Maybe to follow up on that comment, and in the spirit of what Professor Svanberg is talking about, trying to bring and introduce biomedical optics and biophotonics into the next generation, it may be harder in some sense to introduce young kids to physics and mathematics if you're explaining it in the context of physics and mathematics. But if you can introduce some of the optics in the context of biology and medicine, everyone is always interested in some aspects of biology and medicine, how their own bodies work, how you can transilluminate by putting a flashlight in your mouth, for example, and take a picture of all the light that comes out, how you can use your smartphone as a pulse oximeter, and you can measure your pulse, you can look at oxygenation. So there are a lot of biophotonics concepts that you could introduce, including things like light exposure to the skin and the risk of skin cancer. So it's a way of brainwashing people to some extent, but also introducing good science that is based in physics and math and engineering in a way that is maybe more sugar-coated, maybe more easy to digest. So that could be a strategy for you as well. I don't know if anybody is really even doing that, so it could be a good way to do that here. But I wanted to ask you a question about, you've traveled all around the world with many different types of projects and met so many people, and you have probably one of the most unique views of some of the difficult emerging healthcare challenges, both from a therapy point of view and a diagnostic point of view. And you also, I know you travel around with a bag that has lots of medicine in it in case anybody needs it at a conference or any of your colleagues. If you could make a bag of biophotonics tools that you carry around with you, that you could use then as you go through your travels in developing nations, what would be in that bag? And what would you be, now forget about the institutional approvals, you don't have to get any of those. So what would be in that bag, and what would you do with some of the tools that we have in our field that you know all about and have worked with since the beginning of the field?
Yeah, that's not an easy question actually, but I mean.
Or will you just put the Advil in and forget about the photons?
No, but I mean, if I can answer a little bit differently, I would say that what we should emphasize on are the big threats to the whole mankind. And I alluded to that in my second talk yesterday, that this is antibiotics resistance that we develop. And whatever we could do with all these techniques to avoid the overprescription of antibiotics, that's one of these things that I really would like to press into everyone's mind, that we are sitting on a ticking bomb. And that's something I think we have the possibility to solve many of these background factors that are neglected for really full diagnosis of the diseases that really need antibiotics. That's one thing that I think is so important. And you asked what kind of method I should have, or wasn't that a little bit what you were out after?
Well, you know, in your bag right now you
In my
have
bag.
Advil and Band-Aids and
Yeah.
antibiotics, and
I
so would you put
okay.
a special laser system and ALA cream and a camera?
I was once in a plane going back from Beijing to Scandinavia, and a very rich shipbuilding person fell down in the business class. I was in economy class, of course, because scientists are always in the economy class, and I don't know why, but they are not so appreciated, I think. But anyway, he fell down, And we realized that he had a heart attack. And the purser came to me because she didn't know I was a doctor for some other reason and asked, can you help? And of course, being a doctor, we have promised, like Hippocrates told us, to help wherever help is needed. And it turned out that the steward in first class, he was a newly educated nurse from my own hospital. So we were a team immediately there, put together, and I went back to my bag, and I gave this person high-dose aspirin, because that's what I always have with me, because that's what is needed when you have a heart infarction. And I didn't think he had a bleeding, so I gave him that. And then his heart was rushing, and then I had a beta blockage tablet, so I gave also from my bag. So this is something that I carry. And in the view of our eyes, he died. I mean, if you count that you die when your heart stops to beat. So his heart stopped to beat, and of course we were looking at each other, and now it was the doctors and the nurse opportunity here to do something besides giving medication. So we started the standard procedure, because you cannot put the electrodes on the heart when the heart has no activity. You have to have the heart in some kind of activity, because if you put the electrodes on a heart which is not working, you don't do anything good. So we got his heart working by the traditional kind of, and then we did put these electrodes on his chest. And he woke up, and he never noticed that he was not there for a while. And the captain of the plane came out and said, what do? We are just now passing Moscow. It will cost SAS $250,000, whatever currency, to take down the plane here in Moscow. I said, I think we have this man quite stable, but don't go all the way to Copenhagen. I don't know if you know the map, but you first come to Stockholm, and then you go to Copenhagen. So the whole plane landed in Stockholm, and we arranged for an ambulance to take this man. And that was, even though I have been a doctor 40 years or whatever, this was the only case when I, outside the hospital, woke up a patient from being sort of dead. And that told me something. So after that, I always have adrenaline. I have some steroids. I still keep my aspirin. I still keep my beta blockage. And I have some simple antibiotics also in my bag. So I have a black little bag in my bag where I carry medication. And I know that it has been helpful, actually. I don't know, Colin, if you did the same experience sometime. Maybe you did, too.
Yeah, I was called to a chap having an infarct on an Air Lanka flight. And I got there where this diminutive girl about this big was there. I said, what's your specialty? She said, oh, I'm a pediatric doctor. I don't know much about heart attacks. I said, well, I'm just a surgeon. You're on your own, love. No, it's...
Okay. No, and being an oncologist is also the proper specialty for doing these things. So when I came home and told my colleagues, well, this event, which was quite fascinating, they said we should all go through this course again, because after 20 years you forget, of course, or 30 years. So that's a doctor can do something good sometimes, once in a lifetime.
Thanks, Professor.